Hi, my name is Todd. I'm a Canadian pharmacist with 15 years' experience running a pharmacist led smoking cessation clinic. And I am presenting new Canadian guidelines on alcohol consumption and then discussing what this could mean for nicotine. Welcome to Nicotine versus Alcohol.
I think these new alcohol guidelines are extremely well done. They place concepts like patient autonomy and patient centered care as the primary focus. They acknowledge that people will always make their own choices, but public health and healthcare providers can support these choices by ensuring that they are informed.
In 2023, new Canadian guidance on alcohol consumption was published after extensive review of the literature. These guidelines are unique. They don't prescribe a specific maximum of alcohol. Instead, they inform about risk and provide a risk continuum. What are the health consequences of alcohol consumption? Cancer is the leading cause of death in Canada, and the fact that alcohol is a carcinogen that can cause at least 7 types of cancer is often unknown. Cardiovascular disease is the second leading cause of death in Canada. And alcohol is a known risk factor for many types of cardiovascular disease, including hypertension, heart failure, atrial fibrillation, and hemorrhagic stroke. And then it's widely known that alcohol use is associated with liver disease and also increases the risk of violence and injury. These guidelines summarize the increased risk of various diseases or injuries based on the average weekly alcohol use, and it is separated by sex. It varies based on the disease, but the pattern is clear. There's a continuum of risk. As the number of drinks increases, so does the risk. These are the public-facing recommendations. So rather than offering a prescriptive maximum number of standard alcoholic drinks per week, it's trying to articulate alcohol risk exists on a continuum of risk. Patients will have no risk if they consume 0 drinks per week. They'll have low risk if it's 1 to 2 drinks per week. Moderate risk is considered 3 to 6 drinks per week, and increasingly high risk will be noted at 7 or more drinks per week.
So, what does this have to do with nicotine? I think these guidelines are great. The traditional mindset in healthcare is very black and white. Don't smoke, don't drink, exercise, avoid red meat. But we know that reality is much more complex. Patients will make their own choices regarding substance use and lifestyle. These guidelines acknowledge patient autonomy and aim to boost informed decision making. And importantly, they embrace patient centered care, which is considered a gold standard in healthcare today.
Nicotine has similarities to alcohol. Risk is highly dependent on how it is actually consumed. The difference with nicotine and alcohol is the risk is not dependent on the amount of nicotine consumed, but more so the delivery mechanism. We know we have reduced risk forms of nicotine, which are shown in the box, and that many people that use combustible tobacco could benefit from switching to these reduced risk forms of nicotine. I propose that we create a similar guideline for nicotine, where we classify different forms of nicotine according to risk. If we apply the alcohol categories, this is what it would look like. No risk, of course, would mean no nicotine. Our lowest risk category of nicotine would be transdermal and or oral nicotine products. Our moderate risk category would include vaping, snus, and heated tobacco products. And I do realize there's different levels of risks amongst these device types. However, I've simply grouped them together to try to simplify these proposed guidelines. And our high risk, of course, would be combustible forms of tobacco. Of course, when we actually take relative risk into consideration, we have to change the terminology. So really, no risk is no nicotine, but transdermal nicotine and oral nicotine would be very, very, very low risk. And then our vaping, snus, heated tobacco category could be classified as very low risk or low risk, depending on your preference. High risk would remain combustible tobacco.
As healthcare providers, public health, and society, it's time that we follow the lead of these Canadian alcohol guidelines and take a more pragmatic, person centered approach to lifestyle and substance recommendations. I believe these alcohol guidelines need to be more widely shared to inform people about the risk of alcohol consumption so that they can make their own informed decision about what is right for them. And we have to follow a similar principle in regard to nicotine. The risk continuum needs to be shared so nicotine users can make their own informed decision and exercise their patient autonomy. Thank you.